Good morning, my dear students. In the previous video, we have discussed about the insect vectors. In that, Anopheles we have discussed, and today it is about insect vector, that is Aedes. Aedes aegypti and Aedes albopictus, these are the two most prevalent mosquito species across the world. And Aedes, they have the ability to adapt to the new environment, and both the species, they have deserved reputation for transmitting viruses of medical importance to humans. In that first one, that is the Aedes aegypti, and it is commonly known to transmit different types of viruses like dengue virus, yellow fever virus, chikungunya virus and Zika virus, whereas the second one, Aedes albopictus, transmits dengue virus and chikungunya virus. So here it is considered to have the competent vector, that means they have the capacity to transmit the viruses, and there experimentally at least they have 22 other arboviruses, which includes yellow fever virus, Rift Valley fever virus, Japanese encephalitis virus, West Nile virus and Zika virus. Here is the picture of both the species, that is Aedes aegypti and Aedes albopictus. First species, that is Aedes aegypti. It is commonly known as yellow fever mosquito. As an adult, it is small to medium sized mosquito which measures about 4 to 7 mm in length. The body of the mosquito, as you all know, that the insect body has been divided into head, thorax and abdomen. And the head, which consisting of compound eyes provided with the antenna, which are sensitive to chemical cues, and also it consisting of mouth parts. So only the female has the long mouth part or the proboscis, which are capable of piercing the skin. The thorax, which consisting of 2 wings and 6 segmented legs which are attached. Adult Aedes aegypti have white scales on the dorsal, that means the top surface of their thorax, that form the shape of the violin. That shape we call it as lyre, and has typical white marking on the legs. The abdomen, which contains the digestive and excretory organ and is generally dark brown to black, but they may also possess white scales. An identifying feature of Aedes aegypti, it is the characteristic, that is violin or lyre shaped pattern which are present on the thorax region. So Aedes aegypti occupies urban areas with or without vegetation. It bites, rests and lays eggs both indoors and outdoors. This species has a strong preference for taking blood meals from humans and to lesser extent from domestic mammals. Aedes aegypti females require a blood meal for the development of their eggs, and they will frequently take more than one blood meal for each batch of eggs. She lays, which makes them very important vector of human diseases. Aedes mosquitoes feed during the day with a peak activity at dawn and dusk. They tend to feed aggressively on human and on more than one person. Here is the picture which exactly how the viruses, it is transmitted from the mosquito to the humans. There exactly the diseases dengue, Zika, chikungunya and yellow fever. And second species, that is Aedes albopictus, which is commonly called as Asian tiger mosquito. So to the naked eye, both the species, they resembles the same, but the coloration, the color and the white banding on their legs, but the slight difference what you find, it is on the size and the pattern what you find on the thorax region. And this Aedes albopictus is smaller, varying from 2 to 6 mm in length, and they have a single silvery white strip down the middle of the top of the thorax. Aedes albopictus, it is associated with thickets and arboreal vegetation, but will also make use of man-made containers for laying eggs and the development of the immature stages. The mosquitoes are commonly found outdoors and are normally found in areas where they will feed on domestic and wild animals, but they will also feed on humans. So, coming to the role in disease transmission. So, members of the genus Aedes are known as insect vectors for numerous viral infections. The two most prominent species that transmit the viruses are Aedes aegypti and Aedes, that is albopictus, which transmit the viruses that cause dengue fever, yellow fever, chikungunya and Zika virus, and along with many other less notable diseases. In that first one, that is dengue fever. So, dengue fever, which is commonly known as break bone fever, that means the pain what you find in muscle, joint and bone, it is called as break bone fever, which is a flu-like illness which is caused by the dengue virus. So, it is caused when the Aedes mosquito carrying the virus bites a healthy people. This disease is mainly found in tropical and subtropical regions of the world, and these are caused due to the 4 viruses, namely DNV1, DNV2, 3 and 4. The virus enters a mosquito when it bites an already infected person, and the illness is spread when it bites a healthy person, and the virus is spread through the bloodstream. The probability of developing severe dengue fever, also known as dengue hemorrhagic fever, increases if infected with second, third or the fourth time. Coming to the symptoms of dengue, so it causes a fever of 104 Fahrenheit degree along with at least 2 symptoms like headache, muscle, bone and joint pain, nausea, vomiting, pain behind the eyes, swollen glands and rashes. The fever, what you find during the disease, it has been categorized into 3 types, that is mild dengue fever, dengue hemorrhagic fever and dengue shock syndrome. First one, mild dengue fever, the symptoms are seen after a week from the bite and include severe or fatal complications. Second one, dengue hemorrhagic fever are mild but can gradually worsen within a few days. Third one, dengue shock syndrome. This is severe form of dengue and even it may cause death. Coming to the treatment, that is first one, medication, that is painkillers like Tylenol or paracetamol are generally prescribed. Stay hydrated, that means it is crucial as most of our body fluids are lost during vomiting and high fever. Continuous intake of fluids will make sure that the body does not easily dehydrated. Hygiene, which is very important, use of disinfectant liquids and sanitizer are important. Controlling measures. Lesser skin exposure, that is, try wearing long pants and shirts to cover our skin surface and reducing the mosquito bites. Mosquitoes, they are highly active during the morning and the evening, so avoid going out of the home in these time. Mosquito repellents. A repellent with at least 10% concentration of DEET, that is diethylotoluamide, it can be used, and you can also apply ointment daily to keep the mosquitoes away. Personal hygiene. When you are infected with any virus, you have to give you are extra sensitive to other illness, so proper use of sanitizers and also liquid soap will help you to fight against the other germs. Disinfect stagnant water. The Aedes mosquito breeds in clean and stagnant water. Keep water covered at all the times and use proper disinfectant if necessary, and turn over any vessels which can accumulate water and scrub the surface thoroughly so as to reduce the chances of developing a breeding ground for the mosquito. So these are some of the controlling measures for dengue fever. Second one, that is chikungunya. The term chikungunya is the mosquito-borne viral disease, often refers to both the virus, that is CHIKV, and the illness or the fever, that is CHIKF, caused by the virus and transmitted by the Aedes mosquito. So it was first documented in the Tanzania, and the name which is derived from Makonde, which means that bends up, indicating the physical appearance of the patient with severe clinical features. Transmission through mosquito bites. Aedes mosquito transmit chikungunya virus to people. These type of mosquitoes are found throughout much of the world. It is transmitted through mosquito bites. When the mosquito become infected, when they feed on a person already infected with the virus, infected mosquito can spread the virus to the other people through their bites. Chikungunya is often spread to people by Aedes aegypti and Aedes albopictus mosquitoes. They are the same mosquitoes which transmits the dengue virus. They bite during day and also during the night time. So coming to the symptoms, in the picture you can see that is the patients may suffer from joint pain, headaches, a fever, muscle pain, rashes and swelling. These are the early symptoms when you see the chikungunya. So here the other symptoms, what you find it is the fever, headache, tiredness and depression, and also the symptoms you can find like the dengue, that is body aches and all, and also nausea, and other than that you can see the presence of rashes. So the symptoms will begin to appear 3 to 7 days after the bite of an infected mosquito. So coming to the treatment, there is no vaccine to prevent or medicine to treat chikungunya virus. So to rid of chikungunya, get plenty of rest, drink fluid to prevent dehydration, take medicines such as acetaminophen or paracetamol to reduce the fever and also the pain. Coming to the prevention, so do not store water in open containers. Cover tanks or containers for water for domestic use. Do not accumulate trash or in your yard, and cut your grasses, that means garden, in the garden regularly to destroy potential breeding or resting sites. Use mesh or screen on your windows and doors. Use repellents or long sleeves shirts and t-shirts to avoid, that is, getting bitten by the mosquitoes. So third one, that is the yellow fever, which is a hemorrhagic condition that can lead to high fever, bleeding into the skin and the cell death in the liver and kidneys. When the enough liver cells die, liver gets damaged, leading to jaundice, a condition in which the skin takes on a yellowish color. So it is an acute systemic disease, meaning that it starts suddenly and it affects the whole body. The flavivirus causes yellow strand. Flavivirus, that means the positive strand of RNA viruses, that is, they are much suited for transmitting of the diseases that will cause the yellow fever. The virus is transmitted by mosquito, mainly from the Aedes. Role in disease transmission. Yellow fever is spread by mosquito. It can also affect monkeys as well as humans. Mosquito can pick up yellow fever from the monkeys that inhabit the jungle canopy or from infected humans. If a mosquito bites a monkey that has a fever that can pass it to humans, this can lead to the outbreak of yellow fever. Coming to the symptoms, yellow fever has an incubation period of 3 to 6 days for signs and symptoms to appear after a person is infected. The disease cannot spread among humans. Only infection carrying mosquitoes spread the disease to humans. When the symptoms become severe, and they are most of the time they are life threatening, in which the people enter to a stage where we call it a second stage or toxic stage. The yellow fever gets its name from the symptoms of jaundice. Some of the symptoms you can see in this picture. So here, headache, delirium, that means the change in brain, that means the person, they cannot, that is, they are difficult to think, sleep and remember, and aches and seizures in the muscles, where exactly you will feel that is the sudden and electrical disturbances in the brain, and the hepatitis, urinary, that is decreased urination, back pain, high fever, loss of appetite. Next one, eye, that is the redness, sensitivity to light, mouth and nose, that is the bleeding, heart, slow heart rate, skin, the color changes to yellow, that is yellow color, jaundice, stomach, nausea, abdominal pain and the vomiting. So these are the symptoms of yellow fever. Treatment. So there is no effective antiviral medication to treat yellow fever. So treatment consists of supportive care. This includes providing fluid, oxygen, making sure blood pressure is adequate, replacing lost blood, kidney dialysis if there is a kidney failure, and treating any secondary infection. Coming to the vaccination, the yellow fever vaccine, there is a vaccine for yellow fever that will protect against yellow fever for at least 10 years and should be administered before visiting a region for the first time in which someone can catch the disease. Next, that is coming to the preventive measures, that is protection from mosquito. To reduce the exposure to mosquito, avoid outdoor activities during dawn and dusk and early evening. Cover the skin as much as possible by wearing long sleeved shirts and long pants. Stay indoor in places where you can see good screening. Apply mosquito repellent containing permethrin to cloth, shoes and also bed netting. Next one, that is skin repellents containing DEET and picaridin provide protection from mosquito for the longer time than the other products. So next one, that is the Zika virus. Zika virus is the member of virus family, that is Flaviviridae. It is spread by daytime active Aedes mosquitoes such as both the Aedes aegypti and Aedes albopictus. So this is derived from Zika virus, that means the forest of Uganda, where the virus has been isolated in 1947. So the role in disease transmission, it is primarily through the bite of an infected Aedes species mosquito, which can be found throughout the world. When the mosquito bites a person infected with Zika virus, the virus enters the mosquito. When the infected mosquito then bites another person, the virus enters that person's bloodstream. So this virus can also spread to the fetus during pregnancy. Spread of virus through sexual contact and blood transfusion have been reported. Coming to the signs and symptoms of Zika virus, which are like mild fever, rashes, joint or muscle pain, headache and red eyes. So the Zika virus infection may occur during pregnancy, which have linked to miscarriage and can cause microcephaly, a potentially fatal congenital brain condition. So the Zika virus also causes other neurological disorders such as Guillain-Barré syndrome. So here Guillain-Barré syndrome, which is a rare case where exactly the body's immune system attacks the nerves. So when this happens, automatically there will be weakness and the tingling. These are the usual symptoms. Later on the body gets paralyzed. This syndrome we call it as Guillain-Barré syndrome. In some of the cases, the Zika virus may also cause, that is, congenital Zika syndrome, which includes, that is, the birth defects, severe microcephaly with a partly collapsed brain. That means in case where the head is very smaller in case of babies, because the brain does not grow properly. Next one, brain damage and reduced brain tissue, eye damage, joint problem including limited motion, reduced body movements due to too much of muscle tone after the birth. So here in this picture you can clearly see the associated conditions of Zika virus. So that is the first one, that is cardiovascular abnormalities, malagia, that means the muscle pain, arthralgia, that is the pain in the joints, we call it as, then that is Guillain-Barré syndrome. So where exactly you will see ultimately there will be paralyzing of the body. So when it is in the fetus also, it will cause many of the problems like microcephaly, that is next one, that is lissencephaly, that means the smooth brain, that means there will be a lack of development of brain folds and the grooves, and last one ventriculomegaly, that means the enlargement of ventricles which are present in the brain. So all these will be the symptoms or effects of, that is, the Zika virus. So coming to the prevention, there is no vaccine to protect against the Zika virus as as the other viruses. If you are living or traveling in tropical areas where the Zika virus is known to be, these tips may help to reduce the risk of mosquito bites. Stay in air conditioned or well screened area. Housing, well screened housing. Wear protective clothing. Use mosquito repellent. Reduce mosquito habitat, that is the mosquito that carry the Zika virus, they typically live and around the houses. Breeding in standing water, that can collect in such things as animal ditches, flower pots and used that is automobile tires. Reduce the breeding habitat to lower the mosquito population. So these are some of the preventive measures, and along with all these, the Zika virus, it is transmitted through blood transfusion. All the blood donations are now screened for the Zika virus. For further reduce the risk of transmitting Zika virus through blood transfusion in areas where there are no active Zika virus outbreaks, the Food and the Drug Administration recommends not donating blood for 4 weeks if you have the history of Zika virus infection, or if you have travelled or lived in an area with active Zika virus transmission. Thank you.